Welcome everyone to my channel. Please do subscribe it for some medical classes, and even it is important for MCQs. So today we are going to start with epistaxis. So epistaxis, it is bleeding from inside of the nose. So it is most commonly seen in age group like children, adult, older people. Okay. So anterior epistaxis, it is common in children, whereas posterior, they are common in older people. So it often present as an emergency. So it is an ENT emergency. So epistaxis, it is not a sign. Sorry, it is a sign, not a disease. And an attempt should always be made to find any local cause or constitutional cause. Local cause may be fingernail traumas. Constitutional cause most common being hypertension or any bleeding disorders. Therefore, epistaxis is sign due to any disease or condition. So this image shows the Little's area, which is the most common bleeding site for anterior epistaxis, or overall most common bleeding site. So it is made from the anastomosis of four arteries: anterior ethmoidal artery, sphenopalatine artery, superior labial artery, septal branch, and greater palatine artery. So causes, there may be local cause, general cause, or unknown idiopathic causes. So local cause, there may be trauma, fingernail trauma, injuries to nose, any surgery of nose, or hard blowing of nose, violent sneeze. In infection, there may be viral rhinitis, nasal diphtheria, acute sinusitis. In chronic diseases like all crust-forming diseases like atrophic rhinitis, tuberculosis, syphilis due to Treponema pallidum, and rhinosporidiosis due to Rhinosporidium seborrhei. There may be foreign bodies which are local cause. So it is non-living and living. In living, maggots and leeches. Maggots are the larval stage of housefly. In non-living, any neglected foreign body or rhinolith. So rhinolith, lith always means stone. So there may be stone formation due to calcium deposition in nose. Neoplasm, they are also local cause. So neoplasm of nose and paranasal sinus. So it may be benign and malignant. Benign, hemangioma and papilloma, malignant. There may be carcinoma or sarcoma due to some atmospheric changes like high altitude, sudden decompression, or it is also known as Cassion's disease. We'll study later. And deviated nasal septum, which is also the cause for epistaxis. In nasopharynx, there may be adenoiditis, juvenile angiofibroma, any malignant tumor of nasopharynx. Idiopathic, so many times the cause of epistaxis is not clear. So this is Cassion's disease or acute decompression syndrome. It is an acute neurological emergency in divers like scuba diver. So it is caused due to release of nitrogen gas bubble that impedes the blood vessel of spinal cord and brain and result in severe neurodeficit. Also epistaxis is symptom for this disease. So general cause, most common being hypertension, cardiovascular cause, artery or atherosclerosis, mitral stenosis. In pregnancy induced hypertension like eclampsia, preeclampsia. So disorder of blood vessel or blood like aplastic anemia, in which all three cell line RBC, WBC and platelet are decreased, leukemia, thrombocytopenic and vascular purpura, hemophilia A, Christmas disease, scurvy, vitamin K deficiency, liver disease like hepatic cirrhosis due to deficiency of clotting factor like 2, 7, 9, 10, kidney disease like chronic nephritis, drugs like salicylate, aspirin, and other analgesic and anticoagulant therapy for heart disease like heparin and warfarin, mediastinal compression like tumor of mediastinum. So there may be raise in venous pressure in nose. So there may be chances of bleeding. Acute general infection like influenza, which is a viral infection, measles, chickenpox, whooping cough, rheumatic fever, infectious mononucleosis, typhoid or enteric fever, pneumonia, malaria, and dengue fever. Vicarious menstruation. So it is epistaxis occurring at the time of menstruation. So there may be bleeding from other side also, except from the uterus or vagina. Site of epistaxis. So Little's area, in 90% of cases, epistaxis occurs from this side. Other site are above the level of middle turbinate. So bleeding is often from the anterior and posterior ethmoidal vessels. Number 3, so below the level of middle turbinate. So your bleeding is from the branches of sphenopalatine artery. Number 4 being posterior part of nasal cavity. So you're bleeding directly into the pharynx. Diffuse, so both from septum and lateral nasal wall. So septum, it is medial wall. Turbinates and meatus, they are lateral wall. So this is often seen in general systemic disorder and blood dyscrasias or any disorder of blood. And number 6 being nasopharynx. So classification of epistaxis, anterior and posterior epistaxis. So anterior epistaxis, it is bleeding from front of the nose with the patient in sitting position. Posterior epistaxis means bleeding from back into the throat. So patient may swallow it and later have a coffee colored vomitus, which is mostly confused with hematoemesis, that is bleeding, or that is vomiting, blood vomiting. So difference between anterior and posterior epistaxis. So incidence is more in anterior epistaxis, less in posterior epistaxis. Most common site of anterior epistaxis being Little's area, and for posterior epistaxis being Woodruff's plexus. Okay, so age, child and young adult are mostly affected in anterior epistaxis, and older adult in posterior epistaxis. So cause of anterior may be trauma, cause of posterior may be spontaneous or due to some disease like hypertension or arteriosclerosis. So in anterior, bleeding is mild and can be controlled by local pressure or anterior nasal packing, whereas in posterior epistaxis there is severe bleeding. It requires hospitalization and post-nasal packing. So the difference are same. Go through it. Other classification, the childhood and adult epistaxis. So as the name says, childhood, it is for age less than 16 years, and for adult epistaxis, age more than 16 years. So third classification is primary and secondary epistaxis. So primary epistaxis, it is between 70 and 80% of cases of epistaxis which are idiopathic, spontaneous bleed without any proven precipitant or causate factor. In secondary, where the cause of epistaxis is defined like trauma, surgery, or any anticoagulant overdose or any disease. So Little's area, it is most common site for epistaxis in children and young adult. Location is anterior inferior part of nasal septum. So septum being the medial wall of nose. So arteries contributing are 4. So sphenopalatine artery, which is also known as artery of epistaxis, anterior ethmoidal artery, septal branch of greater palatine artery, and septal branch of superior labial artery, which is the branch of facial artery. So these arteries collectively are called as caudal plexus. So thus epistaxis is mainly arterial. Woodruff plexus. So it is the most common site for posterior epistaxis. So location, it is found in lateral nasal wall, inferior to the posterior end of inferior turbinate. So turbinate, we have superior turbinate, middle turbinate, and inferior turbinate. Sometimes we have supreme turbinate. So it is present in lateral wall, inferior to the posterior end of inferior turbinates. Contributing basals are anastomosis between sphenopalatine artery and posterior pharyngeal artery. So these two arteries anastomose to make Woodruff's plexus. Brown's area, so it is located at the part end of nasal septum feature. It is a venous plexus. So Little's area being arterial and Woodruff's plexus being venous plexus. So it is common cause of posterior epistaxis. So this image shows casus plexus for anterior epistaxis and Woodruff's plexus for posterior epistaxis. So these are same. Retrocolumellar vein, so location just behind the columella at the anterior edge of the Little's area. So it is near Little's area. The retrocolumellar vein of this area then runs along the floor of the nose to anastomose with the various plexus of lateral wall of nose. So this common site of venous bleeding in young people. Okay, so common site of venous bleeding in older people is Woodruff's area. Common site of venous bleeding in young people is retrocolumellar vein near Little's area. So we'll talk about management. So in any case of epistaxis, it is important to know mode of onset. It is spontaneous or fingernail trauma, duration and frequency of bleeding, amount of blood loss, side of the nose from where bleeding is occurring, whether bleeding is of anterior or posterior type, any known bleeding tendency in the patient or family, history of known medical diseases like hypertension, leukemia, mitral valve disease, cirrhosis and nephritis, history of drug intake like analgesic, anticoagulant, etc. So treatment, first aid treatment is pinching of nose with thumb and index finger for 5 minutes. So this compresses the vessels of Little's area. The other method is Trotter's method. So patient is asked to sit and lean forward on basin to spit any blood and breathe quickly from nose or mouth, and cold compression, which always causes vasoconstriction. So these are the three first aid method. The first image showing how to pinch your nose. So never to put head in up position. Second one shows the Trotter method, and the third one is for cold compression. Second treatment being cauterization. So it is useful in anterior epistaxis when the bleeding point has been located. The area is first topically anesthetized and the bleeding point cauterized with a bead of silver nitrate and coagulated with electrocautery. So these are the figure for cauterization. So while in emergency, we perform anterior nasal packing. So in cases of active anterior epistaxis, nose is cleared of blood clot by suction and attempt is made to localize the bleeding site. If bleeding is profuse and or the site of bleeding is difficult to localize, anterior packing should be done. So for this, use a ribbon gauze soaked with liquid paraffin or ribbon gauze soaked in bismuth hydroform paraffin paste. So about 1 meter gauze or 2.5 cm weight in adult and 12 millimeter in children is required for each nasal cavity. So packing is done in horizontal or vertical layers. So one or both cavity may need to be packed. Packing can be removed after 24 hours if bleeding has stopped. Sometimes it has to be kept for 2 to 3 days. In that case, systemic antibiotics should be given to prevent sinus infection and toxic shock syndrome. So image A showing the packing in vertical layers and image B packing in horizontal layers. So it is also anterior nasal packing. Posterior nasal packing. So it is required for patient bleeding posteriorly into throat. Posterior nasal pack is first prepared by tying 3 silk ties to a piece of gauze rolled into the shape of a cone. A rubber catheter is passed through the nose and its end brought out from the mouth. Ends of the silk thread are tied to it and catheter withdrawn from nose. So pack which follows the silk thread is now guided into nasopharynx with the index finger. Anterior nasal cavity is now packed and silk thread tied over a dental roll. So the third silk thread is cut short and allowed to hang in the oropharynx, so it helps in easy removal of pack later. Patient requiring posterior nasal packing should always be hospitalized. So instead of posterior nasal packing, a Foley's catheter size 12 to 14 F can also be used. After insertion, balloon is inflated with 5 to 10 ml of saline. The bulb is inflated with saline and pulled forward so that choana is blocked, and then an anterior nasal packing is kept in the usual manner. Here choana is internal layers. So these days nasal balloon are also available. A nasal balloon has two bulbs, one of the posterior nasal space and the other for nasal cavity. So this is the technique for posterior nasal packing, in which both the side are covered and packed with roll. So that diagram showing the procedure how to perform posterior nasal packing. So image A shows catheterization either through nasal cavity and oral cavity. Image second, they are tying dental roll. So third, use your index finger to put the roll inside your oral cavity, and the fourth one, gauze roll should be hanged from the nasal cavity outside. This is the diagram of epistaxis balloon. So A, it is posterior balloon which is inflated with 10 ml, and B being anterior balloon which is inflated with 30 ml of saline. Other treatment are endoscopic cauterization, elevation of mucopericorneal flap, and submucous resection operation. Third one being ligation of vessel like external carotid artery, maxillary artery, and ethmoidal arteries. This also trans nasal endoscopic sphenopalatine artery ligation, and the last one being embolization. General measure. So make the patient sit up with a back rest and record any blood loss taking place through spitting or vomiting. Reassure the patient. Mild sedation should be given. Keep checking on pulse, BP, and respiration. Maintain hemodynamics. Blood transfusion may be required sometime. Antibiotic may be given to prevent sinusitis. So a pack is to be kept beyond 24 hours. Intermittent oxygen may be required in patient with bilateral pack because of increased pulmonary resistance from nasopulmonary reflex. Investigate and treat for any underlying local or general cause. So these are some MCQs from epistaxis. So most common cause of epistaxis in children. So options are given. So most common site of nosebleed in child, and which is known as the artery of epistaxis. So you can see answers. The most common cause of epistaxis in child is nose picking. Most common site of nosebleed in children being Little's area, and artery of epistaxis being sphenopalatine artery. So thank you everyone. We in class here. I'll come up with next topic. Thank you.